Mr. Speaker, as reported by the Manitoba Centre for Health Policy, when the present NDP government came to power, the median wait time for hip replacement surgery was 12 weeks. Mr. Speaker, today, the median wait time for hip replacement surgery is 19 weeks in Winnipeg. Similarly, the median wait time for knee replacement surgery has risen from 15 weeks in 1999 to 23 weeks now. With wait times more than 50% higher than when his government was elected 14 years ago. I ask the Premier, is it his goal to continue increasing wait times for Manitobans in need of hip and knee replacement surgery?
First of all, the number of patients being treated for hip and knee surgeries at Concordia is continuing to go up, Mr. Speaker. Last year we added 64 surgeries. In Manitoba, we performed the second most hip and knee surgeries per capita of any other jurisdiction in Canada, Mr. Speaker. And since 2006, we have cut the number of patients waiting for knee surgery by 60%, Mr. Speaker. Mr. Speaker, by 60%. And Mr. Speaker, that was a high of 56 weeks down to 21 weeks today, Mr. Speaker. And I do have to remind the ex-leader of the Liberal Party, every time we've made an investment in health care, he has not supported it, Mr. Speaker.
Mr. Speaker, I'm not going to support longer and longer wait times in hip and knee replacement surgery. Mr. Speaker, as reported in the Free Press on Saturday, the government is actually cutting back on the number of hip and knee replacement surgeries at Concordia Hospital. You know, it's hardly good planning, Mr. Speaker, to restrict access of disabled seniors to needed health care. One of the approaches that people would expect the government to take to reduce the demand for surgery is to work with Manitobans, particularly seniors, to prevent knee and hip problems in the first place. I would ask the minister, can she table today her present plan to prevent knee and hip problems, to decrease the need for so many hip and knee surgeries?
Speaker, that's a good question because there's a number of things you can do on that. First of all the initiatives we've taken in Manitoba on healthy living, working with citizens to find healthier lifestyle practices, active transportation investments that we've made across this province, Mr. Speaker. The money we invest in municipalities that allows them to deal with issues like snow clearing and proper infrastructure for sidewalks and roads, Mr. Speakers. The disability investments we've made in all of our public buildings in Manitoba, including the front of this legislature, Mr. Speaker, where there never was a disability ramp in the place before. Now it's here in this legislature, and all of our public buildings have done that. So, investments in infrastructure, investments in public buildings, ground path-breaking legislation for disabilities in Manitoba, Mr. Speaker, all of those things, plus an investment in the Concordia Hip and Knee program, which has ramped up dramatically the thousands of procedures that have been performed that have allowed people to get back to their lives as quickly as possible.
Mr. Speaker, the prevention plan is either not very good or it's not working because the number of needed surgeries keeps going up and up and up. Mr. Speaker, senior citizens need hip and knee replacements to regain their mobility. Immobility, of course, causes dependence, but Manitoba seniors want to retain their independence and their dignity. Now, the NDP government has allowed waits for hip and knee surgeries to go up and has responded with no real plan to keep Manitobans healthier so that fewer surgical procedures are needed. It's not clear where this government stands on the needs of seniors in our province with their poor management of knee and hip surgery procedures. When is the government going to present a rational plan for reducing wait times for knee and hip surgeries in Manitoba?
Because the member is coming at this question from two sides. First, on the question of providing services to people. The number of surgeries has actually gone up. We're performing more procedures at a higher quality. People are spending less time in hospitals, getting back to their lives faster. That's the remedial procedures. What about the preventive procedures that he's also addressed in his question? Just a few weeks ago, our Minister of Healthy Living announced another 15 communities that are participating in the Aging in Place program, Mr. Speaker. We're making record investments in personal care homes, record investments in assisted living, record investments in supported living. We're providing infrastructure, which the members vote against, safer sidewalks, safer streets, more active transportation for Mr. Speaker. And as part of our Healthy Living initiative and our Aging in Place initiatives, we do an enormous number of wellness programs in partnerships with senior citizens organizations at the community level. There's congregate meal programs, there's diet programs, there's nutrition programs, and Mr. Speaker, seniors in Manitoba, we work in partnership with them to be able to have a healthy lifestyle in their homes, in their communities, Mr. Speaker.